Hi, good afternoon everyone. This is Alvin Ray Flores and my topic is about the reality therapy. So, to start, okay, so first, who are the proponents of the reality therapy? We have the first proponent is William Glasser. So, William Glasser is currently retired and was educated at Case Western Reserve University in Cleveland, Ohio. So initially he was a chemical engineer, but later he turned to psychology. So he took up MA clinical psychology and then to psychiatry, attending medical school MD in 1953 with the intention of becoming a psychiatrist. So very early, Glasser rejected the Freudian model, partly due to his observation that psychoanalytically trained therapists who did not seem to be implementing Freudian principles. Rather, they tended to hold people responsible for their behavior. So early in his career, Glasser was a psychiatrist at the Ventura School, a prison and school for girls operated by California Youth Authority. He became convinced that his psychoanalytic training was of limited utility in counseling these young people. So from his observations, Glasser thought it best to talk to the sane part of clients, so not their disturbed side. Glasser was also influenced by Harrington, a psychiatrist and mentor. Harrington believed in getting his patients involved in projects in the real world, and by the end of his residency, Glasser began to put together ideas that would later to be known as reality therapy. With the experience of Glasser, he became convinced that it was of paramount importance that clients accept personal responsibility for their behavior. So in 1980s, he was trying to find a theory that could explain his work, and he discovered the control theory from William Powers. But later on, he changed the name to choice theory. So choice theory is the ground theory of reality therapy. So the essence of reality therapy taught all over the world that we are all responsible for what we choose to do. We are internally motivated by current needs and wants, and we control our present behavioral choices. Now for the second proponent of the reality therapy is Robert E. Wobalding. So Wobalding is the youngest of 6 children, and he was born in 1936 in Cincinnati, Ohio. He received his doctorate in counseling from the University of Cincinnati and is a member of several professional organizations and has licenses as a counselor and a psychologist. He taught high school history, worked as a high school and elementary school counselor, and served as a consultant to drug and alcohol abuse programs of the U.S. Army and Air Force. So in addition, Bob Wobalding began a career in the Catholic priesthood but later left the clergy freely and honorably. So he is now married to Sandra Trefilio, a former French teacher who shares his passion for his work and is administrator of the Center for Reality Therapy as well as editor of his writings. So currently he is the director of the Center for Reality Therapy in Cincinnati and Professor Emeritus of Xavier University, where he taught counselor education for 32 years. So after completing his doctorate, Wobalding attended training sessions presenting a wide range of counseling approaches, and he found reality therapy to be the best suited to his interests. So he attended many intensive trainings workshops conducted by William Glasser in Los Angeles, and in 1988, Glasser appointed him Director of Training for the William Glasser Institute. So Wobalding has extended the theory and practice of reality therapy with his conceptualization of the YDEP system, which is described later in this presentation. So we are going to discuss now the basic concept of reality therapy. So in this therapy, Reality therapists believe the underlying problem of most clients is the same. First is they lack either involved in a present unsatisfying relationship, or it could be lack what could even be called a relationship. So I will give an example of a child who has a good relationship with his parents versus a child who doesn't have a good relationship with the parents. So the child who doesn't have a good relationship with his parents may tend to display problematic behaviors inside the classroom. Okay, so for those who are working as guidance associate or guidance coordinator, if you can compare your clients, the clients, clients with problems, clients who come to the office, if you are going to trace back, if you are going to trace down to their family settings, you can conclude that maybe the cause of the problem is or rooted from the relationship with the parents. I have clients also who come to the office who have this problem of self-expectation, too much self-expectation, and as I trace the root of the problem, it was caused because of the relationship with his parents, which is, I can describe it as something not a good relationship between parents and child. So what is the role of the therapist? First, we are going to guide clients toward a satisfying relationship and teaches them more effective ways of behaving. Okay, so this is our rule, So many of the problems of clients are caused by the inability to connect, to get close to others, or to have a satisfying or successful relationship with at least one significant person in their lives. So it is our duty, it is our role to guide them to towards strategies on how to connect to others. Next, recognize that clients choose their behaviors as a way to deal with frustrations caused by unsatisfying relationships. Of course, it is a basic do's in the counseling that we are going to understand our clients. And one way of understanding our clients is recognizing that the behaviors, for example, a problematic behavior is their way of dealing with frustrations caused by the unsatisfying relationships. For example, a child who doesn't have a good relationship with the parents may display problematic behaviors inside the classroom. Again, guidance and counseling, we are not going to judge, So we are going to understand that that behavior is their way of dealing with frustrations caused by that relationships. Next, Glasser contends that clients should not be labeled with a diagnosis except when it is necessary for insurance purposes. Because according to Glasser, diagnosis can only be given to people or clients who have mental illness, like the conditions of Alzheimer's disease, epilepsy, head trauma, and brain infections. Conditions like this are associated with tangible brain damage. So this is the only time that a diagnosis can be given. So therefore, the treatment should be by the neurologist, not for the therapist. So diagnoses are descriptions of the behaviors people choose in their attempt to deal with the pain and frustration that is endemic to their unsatisfying present relationships. So it's like a defense mechanism of dealing with frustration as a result of the unsatisfying present relationships. So as I mentioned earlier. So the reality therapy is grounded and based on the choice theory. Sorry, this is not therapy, but this is theory. So choice theory, again, This is not therapy, this is choice theory. It explains why and how we function. So later on my presentation, I will expound the choice theory. So reality therapy provides a delivery system for helping individuals take more effective control of their lives. So we are going to teach them that they are responsible for their behaviors. So now choice theory. So based on the choice theory, individuals are not blank slates waiting to be externally motivated by forces in the world around them. Okay, so the choice theory do not believe that we are blank slates and we're just waiting for external motivators or external factors. So rather, we are born with 5 genetically encoded needs that drive us all our lives. So these are the survival or self-preservation, love and belonging, power or inner control, freedom or independence, fun or enjoyment. So first, survival. When you say survival or self-preservation, this refers to our basic needs for survival. Okay, like food, water. No? So love and belonging. Our relationship with the family, the community, or to other significant others. Power or inner control, a sense of winning, achieving, and self-worth. For freedom or independence, to be independent, to maintain personal space. Fun or enjoyment, our needs include to achieve satisfaction, enjoyment, and pleasure. So the choice theory is based on the premise that because we are by nature social creatures, we need both receive and give love. So we are social animals, so therefore we need to socialize. So we are capable of receiving and give love. So therefore, it is innate to us to build relationship with others. And not able to build relationship or having an unsatisfying relationship, so that is the cause of our problems. Glasser believes that the need to love and the need to belong is the primary need because we need people to satisfy the other needs. Okay? So it is also the most difficult need to satisfy because we must have a cooperative person to help us meet it. Okay? So so it's hard for us to live alone, and we need others to fulfill our other needs. So if you're familiar with the needs or hierarchy needs of Abraham Maslow, so ang love and belongingness is at the middle, but here in the choice theory, it is the basic need, but it is the most difficult need to be satisfied because it needs cooperative people to help us meet this. So reality therapists teach clients choice theory. So sometimes subtly and indirectly, so clients can identify. The choice theory teaches that we do not satisfy our needs directly. What we do, beginning shortly after birth and continuing all our lives, is to keep close track to anything that we do that feels very good. Okay, so we store information inside our minds and build a file of wants called our quality world. Okay, so our life, we live based on our needs and wants. So I have here a comparison between needs and wants. The needs are the things that we must have in order to survive, and the wants are the things that we would like to have to simply enjoy or to simply feel pleasure. So the needs examples are the food, the shelter, and the food, shelter. Okay, the clothings. The wants are the toys, the bicycle, the cars, the luxury, jewelries, gadgets, and so on. So we have this quality world. So what is in the quality world? So the quality world is the core of our life. So it is our personal Shangri-La, the world we would like to live in if we could. So it is completely based on our wants and needs. But unlike the needs, which are general, it is very specific. Okay, so I want to have this. No, it is very specific. The quality world consists of specific images of people, activities, events, beliefs, possessions, and situations that fulfill our needs. Our quality world is like a picture album. Okay, so we develop an inner picture album of specific wants as well as precise ways to satisfy these wants. For example, I want a brand new car. So how am I going to achieve it? So first, I'm gonna save money. Or if I don't have a source of money, I need to find a job, or I need to find a business now that could lead me to get money. After that saving, I'm going to buy a new car. Or for example, I want to become a registered guidance counselor. So if we are going to create a picture album, so we are going to imagine specific events or specific actions, specific choices that we could take in order for us to achieve that want. So if I'm going to become a registered guidance counselor, the first step is to finish a bachelor's degree in psychology. Second is I'm going to take a master's degree in guidance and counseling. After that, I'm going to take the board exam. So it is very specific. So let us now proceed to the therapy process. So what is the process? How are you going to use this therapy? What are the methods? So the WDEP system, this was introduced by Wobolding, that describe the key procedures in the practice of reality therapy. So just like the other therapy, there are procedures on how to use them. So in reality therapy, there are also specific procedures on what to follow. The WDEP can be used to explore their wants, the possible things that our clients can do, the opportunities for self-evaluation, and design plans for improvements of our clients. So the WDEP is an acronym for W, the wants, needs, and perception, the D for the direction and doing, the E for self-evaluation, and the P for planning. Now let us proceed to the characteristics of reality therapy. So contemporary reality therapy focuses quickly on the unsatisfying relationship or the lack of a relationship, which is often the cause of clients' problems. So Glasser has given increasing attention to the role of meaningful relationships in fostering emotional health. Clients may complain about problems such as not being able to keep a job, not doing well in school, or not having a meaningful relationship. So when clients complain about how other people are causing them pain, the therapist does not get involved with finding fault or blaming. So reality therapists ask clients to consider how effective their choices are, especially as these choices affect their relationship with significant people in their lives. So, what are the characteristics of a reality therapy? So, it emphasizes choice and responsibility. So, we treat clients as they have responsibilities and they have choices. So, if we choose all we do, we must be responsible for what we choose. So, we are going to treat clients as responsible of their choices. So this does not mean that we should be blamed or punished unless we break the law, but it doesn't mean that therapists should never lose sight of the fact that clients are responsible for what they do. Okay, so next is reject transference. So in some traditional therapy, we can use transference in the treatment process, but here in reality therapy, we are going to reject transference. So reality therapists strive to be themselves in their professional work. So for example, if there is a client who will say to you, "It feels like you are my father." So as soon as the client will say that, you are going to answer quickly by saying, "I am not your father. I am here as your therapist." No? Next, keep the therapy in the present. Although reality therapy focuses on the present and in the future, it doesn't mean that it will disregard or it will not accept the past influences that can or the past experiences that can influence the present behavior. Um, it cannot be avoided that clients during the therapy session will going to talk about their past behaviors or past experiences. So it will depend on your skills and on your questioning skills, your listening skills, that you are going to direct the clients to the present and in the future. I know that this is not an easy task because um, even a small mistake, no, if we cannot we cannot monitor the client is now talking about the past experiences. So you need to have the skills in order for you to redirect or to change that the topic to the present or to the future. Avoid focusing on the symptoms. There will be clients who will come to you. I have pain. I'm feeling pain, or I have sleepless nights. Again, in choice theory, those symptoms or those pain, those physical manifestations could be a sign or it could be a message that that is their message of telling the people that that's their way of coping the frustrations as a result of the unsatisfying relationship. Next is challenge traditional views of mental illness. So when clients come to you, it doesn't mean that they have mental illness, especially in the generation nowadays that they are going to exaggerate their illness. Now they have their illness. For example, I am depressed. I have mental illness. Or oftentimes there will be clients, no, maybe I have illness because I'm feeling this way. So we are going to avoid that. So we are going to be cautious, no, because this could be hazardous to physical and mental health. Choice theory rejects the traditional notion that people with problematic physical and psychological symptoms are mentally ill. So it doesn't mean that we are showing the symptoms, we are automatically, or our clients are automatically mentally ill. The therapeutic goal of the reality therapy is to help clients get connected or reconnected with the people they have chosen to put in their quality world. In addition to fulfilling this need for love and belonging, a basic goal of reality therapy is to help clients learn better ways of fulfilling all their needs, including achievement, power or inner control, freedom or independence, and fun. So the basic human needs serve to focus treatment planning and setting both short and long-term goals. Reality therapists assist clients in making more effective and responsible choices related to their wants and needs. And now we're going to proceed to the process, to the therapy process. As mentioned earlier, um, we are going to follow the WDEP system. So first is exploring one's needs and perceptions. So we are going to uncover wants of our clients. So reality therapists assist clients in discovering their wants and hopes. So how are we going to do this? So Wubolding suggests questions that can help us or can help therapists in exploring the wants, needs, and perceptions of the clients. First, one can use this question. If you were the person that you wish you were, what kind of person would you be? Or, what would your family be like if your wants and their wants match? Or, what would you be doing if you were living as you want to? Or, do you really want to change your life? Or, what is it you want that you don't seem to be getting from life? Or, what do you think stops you from making the changes you would like? Okay, so in the therapy process, although this is not the very first question that we are going to ask from our clients, but this is the first question that we are going to use in order for us to go with the process. Okay? So therefore, it is very important that the very first step in doing the counseling process or in the therapy process is to know our clients. Okay? So we can use questions in getting to know our clients, and then followed by these questions in the therapy process. So after that is we are going to know, or we are going to explore the direction I'm doing. So even though problems may be rooted in the past, clients need to learn how to deal with them in the present by learning better ways of getting what they want. Okay, so these are the uh, questions that can help clients gain awareness of and change current total behavior. First is, what are you doing now? So as you can see, if you notice, no, it focuses on in the present. What did you actually do yesterday? Well, even though it's asking yesterday, but the question is trying to explore or trying to gain awareness of the client, no, to change the total behavior. Next is, what did you want to do differently this past week? What stopped you from doing what you said you wanted to do? Or what will you do tomorrow, which is futuristic. Next, after exploring the direction, we are going now to do the self-evaluation. So this is the cornerstone or the turning point in this procedure. So Wubuilding suggests questions like this. Is what you are doing helping or hurting you? As you notice, clients can evaluate what they are doing right now. Is it in line with what they want? Or their choices right now, is it something that can bring them closer to what they want? Or is what you are doing right now what you want to be doing? Is your behavior working for you? Is there a healthy congruence between what you are doing and what you believe? Is what you are doing against the rules? Is what you want realistic or attainable? Does it help you to look at it that way? Is it really true that you have no control over your situation? How committed are you to the therapeutic process and to changing your life? And after carefully examining what you want, does it appear to be in your best interest and in the best interest of others? Okay, so these questions are just suggestions. Well, anyway, you can devise a questions you can devise a question that can help your clients evaluate their current behavior. And the purpose is to let them evaluate of what they are doing. Is it in line with what they want? Is their behavior is in line of what they are trying to achieve? Next is planning and action, and this is the last stage. Wubuilding use the term SAMIC, no, for the planning and action. A good plan must be simple, attainable, measurable, immediate, and involved, controlled by the planner, committed to, and consistently done. Okay, SAMIC, simple, easy to understand, attainable, within the capacities and motivation of the client. So, is it possible for the client, no, to attain that kind of choice? Measurable, are the changes observable and helpful? Immediate and involved, what can be done today? What can you do? Controlled, can you do this by yourself or will you be dependent on others? Okay, so the plan, according to reality therapy, might not work, and if it will not work, if the choice of the client will not work, so you will go again through the process, no, of the YDEP, and it's up to the client and the therapist to work together again on discovering new choices and new plans. So again, counseling special cases can be trial and error. In this last part of my presentation, I will be discussing the components of reality therapy, and I will be giving the recapitulation or the summary of the questioning process. Actually, there are two components of reality therapy. The first is the environment, and the second is the questioning process. So how can we build an environment during the therapeutic process? First is, it is very important to know our clients and know what they want. Next is stay focused. Staying focused with the issue helps promote responsibilities and help clients foster their ability of getting what they want. Next is never give up. Never give up on the belief that change is possible, and never give up on the expectation that change is possible. The second component is the questioning process. Again, as a summary, we will begin with the want, and we can discover the wants of our clients by asking this question: what do you want? Next is doing. What are you doing? Next is evaluate, which is the very important process or the very important part in the process. Is it helping? Is what you are doing is in line with what you want? And lastly is the plan. So what else can you do? So what are your plans? How are you going to achieve what you want? So again, if the plan will not work, the counselor and the client may work again of a new plan. And I will be talking also the limitations of this therapy, the concerns and limitations. The reality therapy has been applied with positive results in school for problems concerning behavior. However, little long-term research on the effectiveness of this approach in school population has been conducted. So these studies are so limited due to the lack of experimental control in areas such as sample size and training of teachers, as well as questions concerning voluntary participation. So while reality therapy has been found to reduce issues with misbehavior of targets groups in schools, findings are limited regarding its capacity for improving the personal experience of youth, their self-esteem and self-concept. So these findings suggest that reality therapy is effective in addressing symptomatic behavioral issues, but not underlying causes and reasons for the behavior. So that's the end of my presentation. Thank you very much for watching. And again, if you have questions, if you have clarifications, if you need more information about this presentation, just send me a message in the group chat, or you can send an email. Thank you very much, and have a good day.